1. What is the primary method for preventing the spread of infections in a healthcare setting? A. Use of antibiotics. B. Proper hand hygiene. C. Use of disinfectants. D. Wearing gloves. Answer: B. Proper hand hygiene. Rationale: proper hand hygiene is the most effective method for preventing the transmission of infections in healthcare settings. Antibiotics are used for treatment, not prevention. Disinfectants and gloves are important, but not as effective as hand hygiene. 2. Which of the following is the correct order for donning personal protective equipment? PPE? A. Gown, gloves, mask, goggles. B. Mask, goggles, gown, gloves. C. Gown, mask, gloves, goggles. D. Gloves, gown, mask, goggles. Answer: C. Gown, mask, gloves, goggles. Rationale: the correct order is to put on the gown first, followed by the mask, gloves, and goggles. This sequence helps to prevent contamination. 3. Which of the following is considered a healthcare-associated infection? HAI? A. Pneumonia acquired in the community. B. A surgical site infection acquired during a procedure. C. A cold from exposure in a public space. D. Foodborne illness from an outside source. Answer: B. A surgical site infection acquired during a procedure. Rationale: HAIs are infections acquired during the course of receiving healthcare, such as infections after surgery. Pneumonia and foodborne illnesses may be acquired outside healthcare settings. 4. When should healthcare workers perform hand hygiene? A. Before patient contact only. B. After patient contact only. C. Before and after patient contact. D. Only when visibly dirty. Answer: C. Before and after patient contact. Rationale: hand hygiene should be performed before and after any patient contact to prevent the spread of infection. It is not enough to wash hands only when visibly dirty. 5. Which of the following precautions should be taken when caring for a patient with tuberculosis, TB? A. Droplet precautions. B. Airborne precautions. C. Contact precautions. D. Standard precautions only. Answer: B. Airborne precautions. Rationale: TB is transmitted through airborne particles, so airborne precautions, including wearing an N95 respirator, are necessary. Droplet and contact precautions are not appropriate for TB. 6. What is the primary method used to sterilize medical equipment that cannot withstand heat? A. Autoclaving. B. Chemical sterilization. C. Radiation. D. Boiling. Answer: B. Chemical sterilization. Rationale: chemical sterilization is used for heat-sensitive medical equipment, while autoclaving is a method of sterilization using steam and high pressure. Radiation and boiling are not typically used for sterilizing medical equipment. 7. Which of the following is the most effective way to prevent the spread of infections in long-term care facilities? A. Routine use of antibiotics. B. Effective hand hygiene. C. Isolation of all residents. D. Daily cleaning of patient rooms. Answer: B. Effective hand hygiene. Rationale: hand hygiene is the most effective way to prevent infections in any healthcare setting. Routine antibiotic use and isolation can lead to resistance and are not as effective in general prevention. Regular cleaning is important, but secondary to hand hygiene. 8. Which of the following methods is used to clean surfaces in a healthcare setting to prevent infection? A. Scrubbing with soap and water only. B. Disinfection using a hospital-grade disinfectant. C. Using alcohol-based hand sanitizers. D. Wiping with damp cloths. Answer: B. Disinfection using a hospital-grade disinfectant. Rationale: disinfection using hospital-grade disinfectants is required to effectively clean surfaces and kill microorganisms in healthcare settings. Soap and water alone are not sufficient for disinfection. 9. What should a nurse do if exposed to a patient's blood while performing a procedure? A. Immediately wash the area with soap and water. B. Report the incident after the shift ends. C. Continue with the procedure and notify the supervisor later. D. Apply a bandage and continue working. Answer: A. Immediately wash the area with soap and water. Rationale: the nurse should immediately wash the exposed area with soap and water to reduce the risk of infection. The exposure should be reported to the supervisor and documented in a timely manner. 10. Which of the following is an example of contact precautions? A. Wearing a surgical mask. B. Wearing gloves and gown when entering the room. C. Placing a patient in a negative pressure room. D. Limiting visitors to 5 minutes of contact. Answer: B. Wearing gloves and gown when entering the room. Rationale: contact precautions require the use of gloves and gowns to prevent the transmission of pathogens through direct contact. A surgical mask is not required, and a negative pressure room is used for airborne precautions. 11. Which of the following is a key element in preventing the transmission of infections in a healthcare setting? A. Limiting the use of antibiotics. B. Strict patient isolation. C. Adherence to standard precautions. D. Daily patient screening. Answer: C. Adherence to standard precautions. Rationale: standard precautions include hand hygiene, use of personal protective equipment, PPE, and safe injection practices, which are essential for preventing the spread of infections in healthcare settings. Limiting antibiotics and patient isolation are not sufficient alone. 12. What should a healthcare worker do if they notice a break in the sterile field during a sterile procedure? A. Continue with the procedure and ignore the break. B. Notify the team and replace the sterile field. C. Proceed with the procedure, but use a different instrument. D. Wait for the supervisor to inspect the break. Answer: B. Notify the team and replace the sterile field. Rationale: if the sterile field is compromised, it is crucial to notify the team immediately and replace the field to prevent infection. Continuing with a contaminated field would lead to an increased risk of infection. 13. What type of mask is recommended for healthcare workers caring for a patient with suspected or confirmed tuberculosis, TB? A. Surgical mask. B. N95 respirator. C. Cloth mask. D. Regular face shield. Answer: B. N95 respirator. Rationale: an N95 respirator is required when caring for a patient with tuberculosis, as it filters airborne particles effectively. Surgical masks do not provide sufficient protection against airborne diseases like TB. 14. What is the correct procedure for removing personal protective equipment, PPE, after caring for a patient with an infectious disease? A. Remove gloves first, then gown, mask, and goggles. B. Remove gown first, then gloves, mask, and goggles. C. Remove goggles first, then gloves, gown, and mask. D. Remove gloves last after the gown and mask. Answer: A. Remove gloves first, then gown, mask, and goggles. Rationale: the correct procedure involves removing gloves first to avoid contamination, followed by gown, mask, and goggles. This ensures that the most contaminated items are removed first, reducing the risk of spreading infectious material. 15. What is the primary purpose of using transmission-based precautions in addition to standard precautions? A. To protect healthcare workers only. B. To prevent the transmission of highly contagious infections. C. To limit the number of visitors. D. To decrease the need for antibiotics. Answer: B. To prevent the transmission of highly contagious infections. Rationale: transmission-based precautions are used to prevent the spread of infections that require additional measures, such as contact, droplet, or airborne precautions, beyond standard precautions. They protect both patients and healthcare workers. 16. Which of the following is an example of droplet precautions? A. Wearing a gown and gloves when in the room. B. Wearing a surgical mask when within 3 feet of the patient. C. Wearing an N95 respirator when entering the room. D. Placing the patient in a negative pressure room. Answer: B. Wearing a surgical mask when within 3 feet of the patient. Rationale: droplet precautions are necessary for infections transmitted by respiratory droplets, such as influenza. A surgical mask is worn within 3 feet of the patient. Negative pressure rooms are used for airborne precautions, not droplet. 17. Which of the following diseases requires contact precautions? A. Influenza. B. Measles. C. Methicillin-resistant Staphylococcus aureus, MRSA. D. Tuberculosis. Answer: C. Methicillin-resistant Staphylococcus aureus, MRSA. Rationale: MRSA is transmitted through direct contact with infected wounds or contaminated surfaces, requiring contact precautions. Influenza, measles, and tuberculosis are transmitted by droplet or airborne routes, not contact. 18. When should a nurse wear gloves in a healthcare setting? A. Only when the patient has a visible wound. B. When performing any invasive procedure or coming into contact with bodily fluids. C. When entering a patient's room. D. When the patient requests the nurse to wear gloves. Answer: B. When performing any invasive procedure or coming into contact with bodily fluids. Rationale: gloves should be worn when there is a potential for contact with bodily fluids or when performing invasive procedures. Wearing gloves without cause can contribute to unnecessary exposure to pathogens and lead to skin irritation. 19. Which of the following is the most appropriate action to take when handling contaminated linens? A. Shake out linens before placing them in the laundry basket. B. Roll linens and place them in a plastic bag without shaking them. C. Wash linens in hot water with soap and water only. D. Leave the contaminated linens in the patient's room until the shift ends. Answer: B. Roll linens and place them in a plastic bag without shaking them. Rationale: contaminated linens should be rolled to contain pathogens and placed in a plastic bag to prevent airborne transmission. Shaking linens can spread pathogens into the environment. 20. What is the recommended procedure for disinfecting a patient's bedside table? A. Wipe the table with a damp cloth only. B. Use a hospital-approved disinfectant and allow it to air dry. C. Use soap and water only. D. Wipe the table with alcohol-based hand sanitizer. Answer: B. Use a hospital-approved disinfectant and allow it to air dry. Rationale: disinfecting with a hospital-approved disinfectant ensures effective removal of pathogens. Soap and water or alcohol-based hand sanitizers are not sufficient for proper disinfection in this context. 21. Which of the following best describes the role of standard precautions in infection control? A. They are applied to all patients, regardless of their infection status. B. They are only necessary for patients with known infectious diseases. C. They are only applied in outpatient settings. D. They are not required if a patient is receiving antibiotics. Answer: A. They are applied to all patients, regardless of their infection status. Rationale: standard precautions are applied to all patients to prevent the spread of infections. They are not based on whether the patient has known infections, but are a universal safety measure. 22. What is the main purpose of using personal protective equipment, PPE, in infection control? A. To protect the healthcare worker from infections. B. To reduce the environmental contamination. C. To prevent infection transmission to the patient. D. To comply with healthcare regulations. Answer: A. To protect the healthcare worker from infections. Rationale: the primary purpose of PPE is to protect the healthcare worker from exposure to infectious agents. While PPE can also reduce environmental contamination, its main function is worker protection. 23. How often should healthcare workers perform hand hygiene when caring for a patient with a multi-drug-resistant infection, MDRO? A. Only before patient contact. B. Only after patient contact. C. Before and after patient contact. D. Once a day. Answer: C. Before and after patient contact. Rationale: hand hygiene should be performed before and after any patient contact, particularly with patients who have MDROs, to reduce the risk of transmission. 24. What is the primary reason for performing regular cleaning and disinfection of high-touch surfaces in healthcare settings? A. To prevent the buildup of dirt. B. To reduce the risk of healthcare-associated infections, HAIs. C. To make the environment look clean. D. To prepare the environment for new patients. Answer: B. To reduce the risk of healthcare-associated infections, HAIs. Rationale: Regular cleaning and disinfection are essential to minimize the risk of HAIs, as high-touch surfaces can harbor pathogens that spread infections. 25. Which of the following is a potential consequence of improper use of personal protective equipment, PPE? A. Increased risk of infection transmission. B. Improved patient outcomes. C. Reduced healthcare worker stress. D. Enhanced patient comfort. Answer: A. Increased risk of infection transmission. Rationale: improper use of PPE can lead to contamination of the healthcare worker and the environment, increasing the risk of infection transmission. Proper training in PPE use is essential for infection control. 26. Which of the following is the most appropriate method for sterilizing surgical instruments? A. Using an autoclave. B. Wiping with alcohol. C. Washing with soap and water. D. Soaking in a disinfectant solution. Answer: A. Using an autoclave. Rationale: autoclaving is the most effective method of sterilizing surgical instruments, as it uses high-pressure steam to kill bacteria, viruses, and spores. Alcohol and disinfectants only clean surfaces, not sterilize. 27. What is the primary role of contact precautions in infection control? A. To prevent the transmission of infections through the air. B. To protect healthcare workers from airborne pathogens. C. To prevent the transmission of infections through direct contact with contaminated surfaces or body fluids. D. To isolate patients with infectious diseases. Answer: C. To prevent the transmission of infections through direct contact with contaminated surfaces or body fluids. Rationale: contact precautions are implemented to prevent the spread of infections that are transmitted through direct or indirect contact, such as MRSA or C. difficile. 28. When should a healthcare worker change gloves while providing patient care? A. After each patient interaction. B. When moving between tasks with different patients. C. Only after handling body fluids. D. Gloves should never be changed during patient care. Answer: B. When moving between tasks with different patients. Rationale: gloves should be changed when moving between tasks with different patients to prevent cross-contamination. Wearing gloves throughout an entire patient interaction is acceptable if no contamination occurs. 29. What is the most appropriate action when caring for a patient with a respiratory infection who is placed on droplet precautions? A. Place the patient in a private room with a negative pressure system. B. Use a surgical mask when within 3 feet of the patient. C. Wear an N95 respirator at all times. D. Avoid touching the patient's belongings. Answer: B. Use a surgical mask when within 3 feet of the patient. Rationale: droplet precautions require a surgical mask when within 3 feet of the patient to prevent transmission of respiratory droplets. Negative pressure rooms and N95 respirators are used for airborne precautions, not droplet precautions. 30. Which of the following actions is essential when performing hand hygiene in a healthcare setting? A. Scrubbing hands with soap and water for at least 10 seconds. B. Using alcohol-based hand sanitizer for at least 20 seconds. C. Scrubbing hands with soap and water for at least 15 seconds. D. Using soap and water for hand hygiene when hands are visibly soiled. Answer: D. Using soap and water for hand hygiene when hands are visibly soiled. Rationale: soap and water are recommended when hands are visibly soiled to effectively remove dirt and debris. Alcohol-based hand sanitizers can be used when hands are not visibly dirty, and scrubbing time should be at least 20 seconds. 31. Which of the following is an example of a high-touch surface that should be disinfected regularly in healthcare settings? A. Ceiling tiles. B. Bedside tables. C. Window blinds. D. Refrigerator handles. Answer: B. Bedside tables. Rationale: high-touch surfaces, such as bedside tables, are frequently touched by patients and healthcare workers and can harbor pathogens, making them a priority for regular disinfection. 32. What is the purpose of using transmission-based precautions? A. To reduce the incidence of hand hygiene. B. To prevent the spread of specific infectious diseases. C. To isolate patients from healthcare workers. D. To limit the use of antibiotics. Answer: B. To prevent the spread of specific infectious diseases. Rationale: transmission-based precautions are used in addition to standard precautions to prevent the spread of diseases that require additional precautions such as contact, droplet, or airborne precautions. 33. Which of the following diseases requires airborne precautions? A. Influenza. B. Measles. C. COVID-19. D. MRSA. Answer: B. Measles. Rationale: measles is an airborne disease and therefore airborne precautions, such as the use of an N95 respirator and placing the patient in a negative pressure room, are required. Influenza and COVID-19 are primarily droplet transmitted, and MRSA requires contact precautions. 34. What is the most appropriate action to take if you accidentally come into contact with a patient's bodily fluids? A. Immediately wash your hands with soap and water and report the exposure to your supervisor. B. Ignore the exposure if it is a small amount of fluid. C. Wait until the end of your shift to clean your hands. D. Apply hand sanitizer immediately. Answer: A. Immediately wash your hands with soap and water and report the exposure to your supervisor. Rationale: immediate hand washing with soap and water is necessary to prevent the transmission of pathogens after contact with bodily fluids. Reporting the exposure ensures that appropriate follow-up measures are taken. 35. What is the best method for preventing the spread of infections in healthcare workers? A. Using personal protective equipment, PPE, for every patient interaction. B. Wearing gloves at all times. C. Proper hand hygiene and use of PPE as needed. D. Isolating healthcare workers from patients. Answer: C. Proper hand hygiene and use of PPE as needed. Rationale: proper hand hygiene is the most effective way to prevent the spread of infections, and PPE should be used as needed based on the patient's condition. Constant isolation or wearing gloves at all times is unnecessary and impractical. 36. When caring for a patient with a C. difficile infection, what is the most important infection control practice? A. Use of a surgical mask. B. Use of alcohol-based hand sanitizer. C. Hand hygiene with soap and water. D. Wearing gloves only. Answer: C. Hand hygiene with soap and water. Rationale: C. Difficile spores are not effectively removed by alcohol-based hand sanitizers. Soap and water should be used for hand hygiene to remove spores from hands and prevent transmission. 37. Which of the following should be done before entering the room of a patient on airborne precautions? A. Wear a gown and gloves. B. Wear an N95 respirator. C. Wear a surgical mask. D. No PPE is required. Answer: B. Wear an N95 respirator. Rationale: airborne precautions require the use of an N95 respirator to filter out airborne particles, which protects against infections like tuberculosis or measles. Gowns and gloves are needed for contact precautions, but not for airborne precautions. 38. How long should you scrub your hands with soap and water to effectively remove pathogens? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer: D. 20 seconds. Rationale: the CDC recommends scrubbing hands for at least 20 seconds to effectively remove pathogens. Shorter durations do not allow sufficient time for thorough cleaning. 39. Which of the following is not a standard precaution? A. Hand hygiene. B. Wearing a mask for all patient interactions. C. Use of personal protective equipment, PPE. D. Safe injection practices. Answer: B. Wearing a mask for all patient interactions. Rationale: wearing a mask is only necessary for certain transmission-based precautions, e.g., droplet or airborne precautions, not as a standard precaution for all patient interactions. Standard precautions focus on general infection control practices like hand hygiene and PPE. 40. What is the best method for sterilizing items that cannot be exposed to heat? A. Autoclaving. B. Using ultraviolet UV light. C. Chemical sterilization. D. Boiling water. Answer: C. Chemical sterilization. Rationale: chemical sterilization is the best option for items that cannot withstand high heat, such as certain plastics. Autoclaving uses heat, UV light is not effective for sterilization, and boiling water does not provide adequate sterilization. 41. When should personal protective equipment, PPE, be removed after providing patient care? A. Immediately after leaving the patient's room. B. After hand hygiene is performed. C. After leaving the healthcare facility. D. PPE should remain on until the end of the shift. Answer: B. After hand hygiene is performed. Rationale: PPE should be removed immediately after patient care, and hand hygiene should be performed immediately after removing PPE to prevent contamination. 42. Which of the following is true about healthcare-associated infections, HAIs? A. HAIs are only caused by bacterial infections. B. HAIs are preventable with proper infection control practices. C. HAIs only affect patients with weakened immune systems. D. HAIs are not linked to the use of invasive devices. Answer: B. HAIs are preventable with proper infection control practices. Rationale: HAIs are preventable with appropriate infection control practices such as hand hygiene, proper use of PPE, and sterilization of medical equipment. They can affect all patients, not just those with weakened immune systems. 43. Which of the following methods is used to sterilize heat-sensitive medical devices? A. Autoclaving. B. Steam cleaning. C. Ethylene oxide gas sterilization. D. Boiling water. Answer: C. Ethylene oxide gas sterilization. Rationale: ethylene oxide gas sterilization is used for heat-sensitive medical devices as it can sterilize at lower temperatures than autoclaving or boiling water. 44. Which of the following is a critical step in outbreak management in healthcare settings? A. Immediate isolation of affected patients. B. Ignoring patient confidentiality. C. Discontinuing all infection control measures. D. Delaying reporting to health authorities. Answer: A. Immediate isolation of affected patients. Rationale: immediate isolation of affected patients is critical to preventing the spread of the infection during an outbreak. Reporting to health authorities and maintaining patient confidentiality are also important, while infection control measures should not be discontinued. 45. What is the primary purpose of using droplet precautions? A. To prevent transmission of infections through small particles suspended in the air. B. To prevent transmission of infections through direct contact with body fluids. C. To prevent transmission of infections through respiratory droplets. D. To prevent transmission of infections via contaminated food and water. Answer: C. To prevent transmission of infections through respiratory droplets. Rationale: droplet precautions are used for infections spread by respiratory droplets, such as influenza and certain coronaviruses. These droplets travel short distances and are typically spread when a person coughs or sneezes. 46. Which of the following is an example of an item that requires high-level disinfection but not sterilization? A. Surgical instruments. B. Blood pressure cuffs. C. Endoscopes. D. Thermometers. Answer: C. Endoscopes. Rationale: endoscopes require high-level disinfection as they come into contact with mucous membranes, but not sterile tissue. Surgical instruments must be sterilized, while items like blood pressure cuffs and thermometers typically require intermediate or low-level disinfection. 47. Which of the following is an example of an infection transmitted via the airborne route? A. Tuberculosis, TB. B. Influenza. C. Chickenpox. D. Norovirus. Answer: A. Tuberculosis, TB. Rationale: tuberculosis is an airborne disease transmitted through inhalation of droplets that remain suspended in the air. Influenza, chickenpox, and norovirus are transmitted by droplets or contact. 48. When should a healthcare worker perform hand hygiene? A. Only after direct patient contact. B. Only after touching contaminated surfaces. C. Before and after patient contact, and after touching any potentially contaminated surfaces. D. Only when visibly soiled. Answer: C. before and after patient contact, and after touching any potentially contaminated surfaces. Rationale: hand hygiene should be performed before and after patient contact, after touching contaminated surfaces, and when visibly soiled to prevent the spread of infection. 49. What is the correct sequence for donning, putting on personal protective equipment (PPE)? A. Gown, gloves, mask, goggles. B. Gown, mask, gloves, goggles. C. Gloves, gown, mask, goggles. D. Gloves, mask, gown, goggles. Answer: A. Gown, gloves, mask, goggles. Rationale: the correct sequence for donning PPE is gown first, followed by gloves, mask, and goggles. This order minimizes the risk of contamination while putting on PPE. 50. Which of the following is the most effective method for preventing the spread of antibiotic-resistant bacteria in healthcare settings? A. Using antibiotics indiscriminately. B. Strict hand hygiene and contact precautions. C. Limiting patient contact. D. Using antiviral medications. Answer: B. Strict hand hygiene and contact precautions. Rationale: antibiotic-resistant bacteria can be spread by contact, and strict hand hygiene and contact precautions are the most effective methods for preventing their transmission. Indiscriminate use of antibiotics contributes to resistance, and antiviral medications do not affect bacterial infections.